This is Radio Health Journal. I'm Nancy Benson. This week, obesity may soon overtake tobacco as the leading cause of preventable cancer.
When you look at the American population, a large proportion of the population qualifies to be at least overweight. And actually, it's again 40% are obese.
How your weight could impact your risk for cancer when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
There are some people who are like, okay, I want a big pile of money because it's going to look pretty. But that's not most people. Most people need to have something in particular that they are working towards.
Is 2022 the year you get your finances in order? Then
I've done a painting of Bin Laden when he was captured and killed, and that was a big cover.
Meeting the man behind some of the most prominent illustrations of our time. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Tobacco is the top cause of preventable cancer in the United States, but that could change in the next 5 to 10 years.
Smoking is the number one cause of cancer, but obesity is a huge influence on cancer. It's coming up pretty close to where tobacco is. Almost, I believe the number is 40% of cancers may be related to obesity.
That's Dr. Anthony Perry, chief of the Department of Outpatient Medicine at Cancer Treatment Centers of America. He's also an advocate for increasing public awareness and education about obesity and cancer risk. He says the two are related. And as almost everyone knows, America's weight problem is getting worse. That means there's an increasing percentage of the American population whose weight may raise their risk for cancer.
When you look at the American population, a large proportion of the population qualifies to be at least overweight. And actually, it's again 40% are obese, meeting the criteria. And what we typically go by in what's characterized as obesity is a body mass index of greater than 30. And so while it's not a perfect measurement of a person's overall fitness, it's the one that most of us go with because it's relatively easy to determine based on what a person's weight and, overall height is.
However, Perry says that cancer risk related to obesity is more complicated than just BMI. It also depends on the type of fat someone has.
It's primarily the central fats within the abdomen that is metabolically active. And when we look at what that is, it's called visceral fat that's the problem. It's the fat within the central abdominal cavity that does bad things. It can promote its own hormonal system of regulating insulin release and pro-inflammatory, chemicals that are at the root of what we think may have something to do with cancer occurrence and reoccurrence.
This visceral fat is key to understanding how weight can be tied to cancer risk. It's the kind of fat that produces an apple-shaped body and lurks near organs such as the liver and intestines. People who are overweight or obese are more likely to have visceral fat, but it's not limited to high BMIs.
This is an association with cancer, so there's not a direct causal relationship that has been proven, but the linkage is real. And the issue isn't necessarily that if you're thin, you're going to not get cancer, because again, there's a million other factors that factor into why a person gets cancer, but also it's the visceral fat that's specifically what we concern ourselves with in regards to cancer risk. And again, visceral fat is what's within the intra-abdominal cavity, not necessarily the love handles that a person has.
Obesity and the presence of visceral fat can also be linked to specific types of cancer.
There's a number that are associated with obesity. I think the ones that we know about are primarily certain types of esophageal cancer, specifically called adenocarcinoma, stomach cancers, colorectal cancers, liver, gallbladder, pancreas, breast, endometrial, ovarian kidney, thyroid. So I think the total is 13. Now, some more than others. So, for instance, endometrial cancer is very strongly associated with obesity.
Considering the link between weight, visceral fat, and cancer, weight loss could be the solution to lowering the risk of developing cancer or its recurrence. Perry says there's not a lot of research on this, but studies are being conducted to test the effects of weight loss.
From a theoretical standpoint, certainly lowering your BMI reduces your risk of getting the cancer. I think the second part of the equation is that if you are diagnosed with cancer, does losing weight reduce your risk of recurrence? And the answer is we don't know yet. And actually, there are studies that are currently being undertaken that take a look at weight management and recurrence rates of cancers. And it makes sense. We believe that it probably will come to fruition, that it will reduce cancer risk.
Perry is hopeful that weight loss could decrease the occurrence and recurrence of cancer. But as anyone who's tried to lose weight would tell you, it can be really difficult. Perry recommends certain approaches for healthy and effective weight loss.
The old paradigm of exercise more and eat less, there's a number of different steps that need to be taken, and a one-size approach doesn't fit everybody. Certainly, when you look at what is effective with weight management, exercise alone is not an effective way to lose weight. It is a critical piece in not only helping with dietary changes, but maintaining weight and then keeping it off. And that's where exercise plays a role.
The second factor to losing weight is diet. There's no one diet that works for everyone, but consistency is key.
When you look at the different types of diets that are out there, they're all relatively effective if you can stick with them long term. Very low-calorie diets do work. The difficulty is that it's hard to maintain them. And so some of the more restrictive diets where you can cut out carbohydrates or weight loss plans such as meals that are made for you, again, they work, but the issue is you have to kind of meet the person at what is going to work for them long term.
Perry explains how he discusses long-term diets with patients.
We talk about trying to eat on a schedule to regularize their eating habits. We also talk about food selections that are sustainable for patients. We also talk about, so what happens when you have a special occasion that you're going out for a birthday? How are you going to modify what you do? And then how do you stay motivated, especially when you meet that plateau?
Although weight loss is complex and can be difficult, it can have many positive effects.
I've had patients who have lost weight primarily to not only help with their cancer recurrence risk, but also to affect their quality of life. So there are absolutely studies that show that patients who are able to lose weight have less fatigue, better body image, their comorbidities are less. And what I mean by comorbidities are things like long-term things that affect cardiovascular health, like diabetes and hypertension are reduced.
With obesity projected to overtake tobacco as the #1 cause of preventable cancer in the United States, Perry says it's important to understand how body fat and weight play a role. The exact link between weight loss and cancer reduction is still unknown, but losing weight can still lead to a better quality of life for more than half the population, without regard to cancer risk. Our writer this week is Morgan Kelly. Our studio producer is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
It's not only about how well they can do their job and shoot at the target and use force when needed or not. It's also about their stress, it's about their sleep, their food, and those kinds of interventions are missing.
How do we help America's most sleep-deprived profession, law enforcement?
Then things to consider when it comes to pet food.
Obesity affects up to 2/3 of dogs and cats that present to their veterinarian, so it is the most common nutritional disorder that veterinarians are faced with on a daily basis.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.